afternoon, everyone, and welcome. Thank you so much for joining us today on our virtual panel discussion on the future of residential aged care, driving better care and sustainable operations through innovation. I'm Alicia Schottler, and I'm the National Aged Care Practice Lead for Connected Health and Wavelink. The aged care sector is at a fascinating and pivotal moment. New standards and funding models are pushing us to all think differently about how we deliver care, focusing on making it more efficient, transparent, and most importantly, centered around the needs of the residents. I'm thrilled to be here with you today as we explore some of the exciting technologies that are transforming the way aged care providers operate, ensuring compliance while also enhancing both staff and resident experiences. We're lucky to have David from Accredia joining us live to share his insights on how technology is helping providers navigate these challenges. We also have a pre-recorded conversation with Barry Johnson from Signature Care, who has generously shared his on-the-ground experiences of implementing these innovations. Unfortunately, Kate Billing from Carina Care Carina Lodge couldn't be with us today, but she has sent her apologies. Now, before we dive in, just a bit of housekeeping. If you have any questions during the session, feel free to pop them into the GoToWebinar control panel, and we'll do our best to get them answered for you today. And don't worry if you missed something. We'll be sharing a recording of the session with you in the next few days. Now, let's get started. David, thank you so much for being here today. Can you kick us off with an introduction of yourself and Accredia?
Thanks, Alicia. It's really good to be here today to partner with you on this InfoBite. My name is David Richter, and I'm a customer strategy manager with Accredia. So it's my role to work with the different providers to really understand the needs of the organization as they grow through this digital age, and also with the ever-changing landscape that they're all dealing with. It's really good to showcase some of the Accredia platform today, but also the technology that supports us as well. Now we'll pass over to Barry, and we'll kick off this InfoBite.
Yes, my name is Barry Johnson. I'm the General Manager of Quality and Innovation with now Lucon. Previously it was Signature Care. We've just recently been acquired. And I've been in aged care for, gosh, it'd be nearly 25 years now.
Wow.
And I'm a nurse, a nurse, Navy man before that. But yeah.
So in today's session, we will explore the pivotal role technology plays in helping aged care providers navigate this new era of care delivery. We'll delve into how innovative solutions are enhancing communication, collaboration, and workflows within aged care facilities, ultimately enabling care workers to stay connected, support one another, and better respond to residents' needs. From tracking care delivery with real-time visibility to leveraging data for improved decision-making, today's session will provide valuable insights into how technology can drive efficiency, compliance, and a sustainable resident-led care model. Our expert panelists will share their perspectives on the latest technologies revolutionising the sector, from tools that improve resident engagement and satisfaction to solutions that streamline reporting and compliance. We'll also explore how providers can stay ahead of the curve in staff recruitment and retention while meeting the updated screening requirements of the new regulatory landscape. So we are so excited to explore these key topics with our esteemed panel experts, and we hope you leave today's session with actionable insights and a clear understanding of how technology can help you address the challenges ahead. So let's dive into the discussion, and thank you for joining us. David, just to start, would you like to give an introduction of Accredia?
Of course. So Accredia is an end-to-end software solution. We've been around since 2019. Signature Care, or now Lucon, and the team there with Barry Johnson has actually been with Accredia for pretty much that entire time. And we're really built on co-design. So companies like Signature Care and people like Barry have helped to shape Accredia. We've built it on new technology, which means that it's scalable, it's a full cloud solution, and it's built for compliance. The name Accredia actually comes from the word accreditation, and that's always at the forefront of our mind. So that's a little bit about us, and you'll hear more about it over the course of this webinar.
Thank you for that context. Barry, I mean, Signature Care, now Lucen, has been pivotal in shaping many features of Accredia's platform, as David mentioned. Can you share why your organisation chose to partner with Accredia and what challenges in aged care services you wanted to solve?
Yeah, sure. I guess one of the very first challenge that comes to aged care is just the amount of disparate sort of software solutions that organisations use. In particular, you know, the clinical management system and the medication management system, and you know, rostering and finance systems as well. You know, OHS sort of software solutions also. So what Accredia brought to the table was was having it all in one place, and I call it operations in a box, because we have the clinical management system and the medication management system, but we also have the document management system as a part of that. So our policies and procedures are within, and quality and safety. So you know, the continuous improvement plan, feedback register, hazard alert register, like just to name a few. So it's basically everything in one place. So that's what attracted us. So we don't have to sort of pay for subscriptions. We just have the one, basically.
So, David, I mean, that's a really good point, Barry, because it is that all-in-one solution, so you can tackle multiple challenges. But how is it designed to meet the evolving needs of aged care providers?
So the technology that Accredia has been built on allows for not just an end-to-end solution built in our own platform. We're also interoperable with other systems as well. So there are certain components within the aged care mandate that we don't cover, and we probably never will, like a full finance system like your Xeros and MyObs, but we're interoperable with them through our API. As Barry said, you don't really want to have 20 different subscriptions and managing those, and you basically have to have a contract management team just to deal with all of that. So Accredia has been able to condense the number of subscriptions that providers have. And when I say end-to-end, we cover everything from the initial opportunity or inquiry of a potential resident, and we take their data all the way through to the end of care with a facility. So that means you're able to manage not only the resident profile, all their clinical needs, their daily care, but also the quality data that comes from it as well. So ensuring that you've got the ability to capture all of the information, as well as, you know, a family app that we communicate directly with families, automation of care statements, which Barry again has been pivotal in these new apps that come out. So these are the opportunities that a platform built on this new technology can provide.
Amazing. And Barry, oh, sorry, I was just going to jump in and say, you go, Barry.
Just the other aspect of Accredia, which we really truly appreciate, is the customization. So it allows us to respond very, very quickly to any changes in legislation or any changes in compliance, or if we have a site visit and there's something that we need to sort of attend to immediately, like adjust a form or create something, a new process, that we can do that very, very quickly, and within an hour we can create that to the satisfaction of the auditors, which is absolutely pivotal, especially in this day and age where compliance has just increased tenfold, I would say, over the last couple of years. So for us, Accredia allows us to move with the times. It's not just off the shelf where you have to wait for a developer and you have to wait 6 months till user groups come out and sort of agree on an improvement. So an example would be with the last year with the NQIP additions. As soon as we got notice of that, we put things in place so that we could respond immediately. And so it was very, very responsive. It's a great platform for that.
Mm. And we've also, in conjunction with Barry, using the care statements, we actually met with the Department of Aged Care, and they mentioned that no one yet had been providing those care statements to any of their residents, when in actual fact Barry and the team at Lucent or Signature Care had been doing it for almost 6-7 months at that point, Barry.
Yeah, that would be right. Yeah.
Yeah, so it's the speed at which we can adjust to the changing landscape.
And Barry,
the
I
nice thing
imagine
about those,
sorry, I'll let you go.
sorry.
You go.
The nice thing about those care statements is that there's no inputs by the clinical staff or anybody. It's actually pulled directly from the assessments that are completed within Accredia. So effectively, we produce a care statement just with a push of a button. We were originally part of the pilot when they were looking at the care statements initially, and all the other providers had to produce their care statements on a Word document, which was extremely time-consuming for them, and they were just at a loss how they were going to introduce the care statements in their organisation. But with Accredia, push of a button, and not only that, you can send it to the next of kin as well. So you can automate that process also for those where the residents prefers the family to receive the care statement.
Fantastic. And I think you've certainly shed some light on the impact that Accredia has had on your day-to-day operations. But what about in terms of, I guess, staff workload, resident care and efficiency? What impact have you seen on that side?
So the impact on the clinical staff has certainly been positive, but it's not just the clinical staff. As I said, Accredia is operations in a box, effectively. So it's add efficiencies to the residential manager, the clinical manager, the maintenance, cleaning as well, and certainly through administrative staff. But on clinical staff, it's been a bit of a game changer because they are able to access reports that are easily produced. And like, I'm a nurse, I'm not a I'm not technically minded that much anyway. But the reports are easy to produce. And
yes,
as I said before, if you have an unannounced visit and you've got to produce a report within minutes, you can do that with Accredia very, very easily, and I've done that many times. And the response that you get, which is the response you want to get, is that your organisation is so responsive, or the home is so responsive to requests from the Commission. And that's one thing that we look forward to hearing. And it certainly bodes well for us if we ever do run into a problem. And these days, you always run into a bit of a problem during a visit. We're able to sort of mediate that.
Fantastic. And David, from your perspective, what makes Accredia's platform different from other solutions in the aged care market? Particularly, you touched on it earlier in configurability, compliance, and cost efficiency.
So I think cost efficiency we've covered quite well in terms of the number of other subscriptions that you can reduce by having this one all-in-one system or operations in a box. But the other areas that you can increase those cost efficiencies is the real-time data transfer from the other applications that we do integrate with. So, a lot of providers out there are using companies like BestMed, MedSig, etc. We have native integrations with them already. So you're not losing time when you're trying to look at your data. We've also got integrations with Epicor, PainCheck, the list goes on. So these kind of integrations, your data is your own. And that's a big thing that Accredia believes. Other vendors out there try sometimes to control a little bit of that. We don't believe in that. We think that a provider with their data should be able to use it in the ways that they want. All of that leads to a much more compliant organization when you've got transparency. The configurability of the system as well allows those facilities to adapt the Accredia workflow to their policies and procedures rather than the other way around. And that means that change management, if you're coming to Accredia, is a lot less impactful, but it also allows you to streamline a lot of that as well.
Yeah, and I think that's important when we're looking at tracking of what's being completed, and that essential compliance with operational planning. How does Accredia help providers manage this effectively and reduce administrative burden, David?
Yeah, so there's a number of different tools that Accredia has available. One of those is through the Care Direct app, and that Care Direct app is based on mobile technology. In-room efficiencies are improved greatly, as well as the delivery of care. But just in relation to care minutes, which is on everyone's lips at the moment, to manage those care minutes or track those care minutes in Accredia and through our mobile app, as simple as walking into the room, knowing who you're talking to because of our Bluetooth technology, clicking the button to time those care minutes, and everything's recorded. So it's so much more simple, and that way, once that's been recorded, you can report on it. Everything down the line, your AN-ACC funding and everything else just flows on.
Yeah, and I think that's a really good comment to bring up, because I know that you are doing continuous innovation. The journey that the carers at Signature Care, now Lucen, follow is they have a single device where they get their telephony, their nurse call, as well as the Care Direct application on there. So, but they're continuously moving room to room. They walk into a room, they do scanning by NFC with a dot on the wall, and it opens up that resident record. They're able to complete tasks, which are then updated in the back end in real time. But you've looked at that and you've gone, okay, how can we streamline that again? And that goes into that Bluetooth technology. So the next generation is that ability to walk into a room and basically via Bluetooth, it's pulling down the residents' information, opening up that record, being able to then track the time spent within that room. And again, it's that integration with technology. When they work out, that time is all automated on the other side, which is super, super powerful. And it just shows that, when it comes to the integrations and working with partners, it's not just, okay, this one works really well, let's stick with this. It's okay, how can we continue? How can we develop? And how can we get better?
Okay.
And Barry, I know for you, it's been really powerful to be able to track in real time that care facilitation and how your residents are being looked after in your facilities. And how did that tracking help improve your staff scheduling and help you meet compliance? Have you seen any noticeable time or cost savings with the feature and using that Care Direct application?
Yeah, absolutely. One of the key savings has been just with staff not milling around the care stations, because care staff are on the floor, which is of great. It's great for families to see that. Usually they walk around the corridors like in the afternoon and they go, can never find anybody. That's usually the comment that you hear. But with Care Direct, the staff are on the floor because they're not entering data into a stationary desktop. They're actually putting the data in via the Spectralink phones that they carry, and they're completing their charting. So the benefit to the residents is that they're getting real-time charting. So staff would traditionally carry around a scrap of paper or a handover sheet, and then they'd write down what they did. And then at the end of the shift, they would sit down at the computer, and then they'd enter that into the computer. And there's usually a bit of a jostling around, just trying to get to the desktop. And we pride ourselves on the number of desktops that we have, but still there was always that jostling for a spot to enter their information before they went home. Now, with the Care Direct, we've a bit of a reduction in falls because the staff are on the floor. So they're able to capture a potential fall and prevent that from
because they're
occurring.
there, they're
So
close, they're able to help.
They're there. They're able to see the events that lead up to a fall, and then interrupt that process before it actually results in a fall. And also the same goes for behaviour management. Because the staff are on the floor and they're walking around and they're seeing residents in their room, they're able to sort of intervene before behaviours escalate, responsible behaviours escalate. So it's extremely beneficial. And also the other thing is that when they're in the residence room and they're sort of tapping, like tap and go, which we call it, they're tapping as to the care that they're provided. It just means that there's more the period of time that their eyes are on the resident has increased.
It's more meaningful interaction.
It's more meaningful interactions. And, with Care Direct, the PCA staff are able to alert the RN if there's a potential SIRS, or if there's a wound, or if there's a fall. They're able to sort of alert the RN as well through.
And we built that stop and watch tool into that as well, Barry.
Yes.
So
identified
them being able to follow that flow chart and taking the time to actually watch their residents and take in the information as well to give better outcomes.
So the stop and watch tool is there for the carers to identify deterioration in the resident. So it's a number of parameters which was built into Care Direct, and this is another power of Care Direct, is that you can produce it's easy for me to produce the buttons for the staff to document their observations. So that's really easy. So if I have to make a tweak to anything, I can. It's very good. So it's not just a static thing that you have to use and that's all you get.
And I guess the other question, Barry, is that from a monitoring tool, so being able to see the care and the interaction, has this helped you with your has those data insights that you're capturing actually helped you with things like resource allocation, staff rostering, being able to see, get those key data insights to plan the care and plan your staffing as well?
Yes, it does. Like night duty is always a bit of a challenge, and what we've learned from our charting and the information that's come from Care Direct is that we're able to identify what residents need more care, more charting. So night duty is usually like the quiet time, but a lot goes on during the night time. So we're able to see what staff have been seeing what residents through a resident check, which I don't know. Like traditionally in the past, night duty without Care Direct, night duty would just go around and do their night duty checks. But with Care Direct, with the NFC chip, they can just go in and just tap when they walk in to see a resident, they can tap it and then say whether they're asleep or awake or absent. And that, as I said before, it's just more eyes on the residents. So we actually know that a staff member went into that resident's room and actually, laid their eyes on that resident just to make sure of their well-being. Yeah.
Fantastic, thank you. And I mean, resident-led care, it's increasingly important in aged care. Barry, how did Signature Care, now Lucen, contribute to the development of resident-focused features such as monthly care statements and transparent feedback processes in Care Direct?
So how do we contribute to that? That's the question.
Yes.
Yeah. So I always like to say with Care Direct and with Accredia in general, it's sort of like it's made by nurses for nurses, because we contribute a fair bit, like the nurses contribute to the development of Accredia, because the nurses will contact me and say, oh, it'd be good if we have this feature or this feature, which they would know that they need, because they're at the front line, and if there's something missing, they're the ones who know. And so and we try to accommodate that as much as possible, because we're interested in making sure that the life of the carer, the life of the clinician is runs smoothly when they're at work, and make things easier for them. So that's what our mission is, effectively. And we've had some great sort of enhancements, customizations to Accredia, which has made it so much easier for them to do their day-to-day job, because it's hard these days. It's getting harder and harder for them. Yeah.
Yeah, and I guess, David, Barry's given some really good examples of how Accredia's platform supports staff in delivering personalised services back to residents, but how does it empower residents to actively participate in their own care?
Yeah, so there's a number of ways that Accredia has been able to connect not only with the residents, but with their next of kin as well. So Accredia has built a family app, as we discussed earlier. Back in 2020, it was launched. Obviously, with the lockdowns, it was important for family members to still be able to interact somehow with their family that's in the facilities. And having that secondary bridge is a superb way of getting feedback from the residents that may not be able to be delivered to the care staff. There's always, not always, but there's sometimes a barrier. There's sometimes a nervousness or other.
I don't want to bother you, but I will tell my son or daughter.
That's right.
Yes.
So this type of communication has opened up more ability for the resident's voice to be heard. Sometimes it's the family's voice that gets to be heard as well, when they felt that they didn't have any way of communicating what they were feeling or seeing around a facility. So having that two-way communication now has opened up a lot of that. We also have inbuilt all of the surveys, quality of life survey, etc., that the care staff can actually take out a laptop or a tablet and sit down with the resident and complete it with them in person, with a nice interface that it can be done on. So again,
and then again, that's fed back real time back into the system, so there's no double handling.
Correct.
There's no entering that data later.
That's right.
And Barry, what feedback have you received from residents or their families on the impact of tools like, the staff using Care Direct, as well as the family application?
I think the first off, the care statements have been like a game changer for families. They receive that for the families and the residents. We've had residents who, when they received this care statement, which they were almost in tears when they received it. We give out the full care plan, but that's a big document. The care statement is like basically 2 pages, and it outlines a lot of areas regarding that resident's care, as well as their well-being. So it captures well-being activities and visitations, like when people have visited their home. So that's been a game changer. The other one is the family app. With the family app, the families can leave feedback. They can request a hairdresser. They can book the dining room if they want, the private dining room. They can request put in a maintenance request or a hazard. So the interaction with families is two-way, and we've just recently added a clinical issue as well in that suite of options that they have on the phone app. That they can raise a clinical issue. And as far as the other end, like our end, once we get that feedback, that goes through to self-service area, and then that is how we manage that. Is that the request comes through via email, and then we include the clinical. Say it was a clinical issue, we include that clinical person in that email, in the reply to the family member saying what we've done. So it's an immediate response, and connected with the relevant people, and that's helped enormously with complaints and whatnot because it's more transparent and open. It's been fantastic. And as I said, with Care Direct, the families obviously can see the staff on the floor, which is important. And they're able, and because they can see them on the floor, the families can come to the staff member and inquire about whatever, instead of them wandering around going, I can never find anybody. They can actually see them and interact with the staff members, which is great. And like I said, the residents themselves, they're actually interacting more with the staff because they're not disappearing to do the documentation. And I guess that was the intent of the development of the Care Direct, I think. And we're sort of exploring the application, expanding into like clinical as well, so that it's not just carers.
Yeah, and that was going to be my next question, Barry. So, have these tools also positively influenced staff satisfaction? Do they feel like there's less pressure or they're supported better and they're able to fulfill their roles easier?
Yeah, well, they were very excited at first when they were given the SpectraLink phones, because usually they're given a DECT phone, which is a dumb phone, and then all of a sudden they've got a phone that's they can interact with. And one of the things which I haven't mentioned yet is that they can make a progress note from Care Direct. So we use voice to text, which has been fantastic. So staff can make a progress note in the residence room as they're providing care if they want to. And the voice to text is not a problem. So with people with accents or strong accents, it's not been a problem thus far. So it's been fantastic, that aspect of it, for sure.
Fantastic. Barry, with adopting Accredia, has the overall staff satisfaction improved? Have you seen a reduction in turnover or improved engagement as a result?
Yeah, it has improved. We just finished. We just completed a huge staff survey across the group, and the satisfaction is high. So especially around, because we did ask questions about the software that they interact with on a daily basis, including Care Direct, and it's been 70% high, 70-80% satisfaction.
Fantastic! Wow. And David, what features of Accredia's platform directly support this staff satisfaction? Such as automating those repetitive tasks, improving workflows.
So there's, and I'm sure Barry can speak to this as well, there's a number of features within the Accredia platform itself, such as the intranet, where you can send out your blast of what's happening today or this week. Any updated policy or procedure documents are right there as hey, this has been changed, look out for it. That can really improve a lot of people going, oh, I didn't know, or what's happening this week. On top of that, you've got their self-service tab within Accredia, where they can just go to that self-service tab and complete their own maintenance requests, their own hazard requests. It speeds up that efficiency a lot, as well as having their own checklists that they can have created for their role. So those checklists can just be a guide for, I'm beat, I'm tired, I get into work, I can just open that and go, oh, it's all there. So that helps to improve a lot. But I think
it's almost like decision support too. It's like, what do I need to do? And then I don't have to think about, what I need to do to achieve my goals. I can see it. I can access what I need on the spot.
And that Care Direct, the daily charting in Care Direct has been superb. And again, I think even Lucen now, Signature Care, they are very good at turning on daily or scheduled tiles within Care Direct when you're trying to achieve a different outcome or see an audit outcome. So you can adapt Care Direct very easily, so the staff just know that's what I need to do today. And it just makes their life a lot easier, I believe.
So just another area that's improved, and the managers have done this off their own bat, because I think traditionally we all know about the memo folder that sits in the staff room that everyone's got to sign that they've read it. So we used to have the same thing in Accreditor, and on the intranet we used to put up memos as well. So they used to publish a memo and put it out there so all the staff could, that they could see it and read it. But what they've done is they've moved away from that completely. So there's no more memo folder in the staff room. They now use the messages as their form of sending out memos to staff, which is fantastic, and it's actually more efficient to do it that way because you haven't got someone typing out memos, putting it into a folder, printing it out, putting it in a folder, and then just collecting signatures on those who turn up. At least with the messages, we can run reports to see who's read them, if that's necessary. And I think, and the self-service has certainly been a big, that's been around for a long time, but staff being, and I was sort of underestimate its power because, staff can do a maintenance request. As soon as that maintenance request is completed, it's straight through to the maintenance register and the maintenance man's right onto it. Same as the cleaning register as well. As soon as there's, a mess in one of the residents' rooms, they will enter that in and the cleaner's there. Because they all have a tablet on the maintenance trolley or on the cleaner's trolley. Again, it's just made a huge change for the way we operate. I just don't know what we would do without Accreditor. Like I couldn't imagine how other organisations ensure compliance or ensure efficiencies. Because we've been using it so long, that's what we know now. So, and we wouldn't want to go back. That's for sure.
Yeah.
That's fantastic feedback, and I think you've made some really important points there, and things that people listening can definitely take away and think about and look for room to improve what they're doing. Now to change, I guess, the tone a little bit, looking on the side of compliance and security, David, with the upcoming Aged Care Act in 2025, how does Accreditor's platform help providers stay ahead of compliance requirements, particularly around reporting and transparency?
Well, by utilising industry experts like Barry. So, Barry, I believe that you've already been working on this list with Liz and Charles. So Liz and Charles are part of the Accreditor exec team. When we see a change to industry, we know that we need to be first to react. And that means going out to industry and finding out on the ground what this means to an organisation. And so when you're talking to your users, the providers that are using your system, you actually understand better the mapping process within the system. So when it comes to reporting and transparency, for us, any of the data that's in Accreditor can be reported on. All of that data as well can be transferred to wherever and brought in from wherever. So all of this is part of Accreditor's mandate as the industry changes. And I think Barry can talk a little bit more about that as well.
Yeah, Barry, did you want to expand upon that with some real life examples?
Yeah, I mentioned one already when we had the change with the NQIP, and we adapted very quickly to that. Others were still sort of trying to work it out. With the consumer experience and the quality of life surveys, with also whenever there's been with changes in SIRS, we just adapted by adding additional questions to whatever assessments we needed to do, which then added that to the register. So the really nice thing about Accreditor is it's form based. So you can create a register out of any form effectively, and that's what we've done to ensure compliance. The other thing that, in our situation, we have what's known as a system health check. It's just an audit that we created, and it audits a home against about 76 questions, which our quality department audits the homes. but they do that remotely, so they're able to jump in, and it's not like, unlike a clinical management system where you can jump in and you look at the, you can look at the clinical aspects of the standards, but then you sort of, it stops there, because then how's
Yeah.
someone remotely going to look at the managerial side of things, or compliance, HR compliance. But with Accredia, so we're able to audit across the current 8 standards as they are today, and produce a report, which then we benchmark against each other, and that goes to the board, that report, and we're able to quickly and easily remotely audit the homes. Also, the other side of it is whenever we have an unannounced visit, the quality department jumps straight into Accredia and just checks to make sure that everything's up to date. So if we've got an unannounced visit in Queensland, we're able to do that down here in Victoria. Just check the home, just to make sure that it's all good to go, if you know what I mean. Yeah.
Fantastic. And David, I think that's, this transparency and the access and the way that the system is able to very quickly adapt is great, but security, it's always a big concern. So, you've got all that sensitive data. How do you make sure it's protected while allowing that accessibility to staff?
Of course. So obviously, Accredia, all of the data is housed here in Australia under all of our laws. But secondly to that, we've got a very stringent and very thorough user restriction or user access matrix. And we spend a lot of time with the different providers to actually set that matrix up individually for each different provider when we're completing an implementation. That ensures that you only have access to what you need to see within the system, and you can only do with that data what we allow you to do within that system. So as an example, if you're an agency staff member, you're coming in specifically to work this wing for this evening only, and that's all you'll ever do, you'll only have access to those 4 people that you're going to be seeing tonight. As an example, those 4 residents you'll be seeing tonight. If you're a clinical nurse, a registered nurse, and you've got access to the full resident profile, but you won't have access to things like their financial information. You can literally restrict individual documents or parts of documents within Accredia. So that's a very important part of how we establish the securities within the system across a group.
Fantastic. So Barry, how has Signature Care leveraged Accredia's tools to not only minimise compliance risks, but reduce time the staff spend on administrative tasks? And have you been able to quantify that?
Yeah, so we did a time and motion study just before we implemented say Care Direct, and then after. We found that there was probably about an 8-minute per hour difference as a benefit, which doesn't sound much, but when you calculate that over a year, it's about a $300,000 saving just in a year.
Wow.
And that's for like 120 facility. It's quite impressive. We use that to offset also the cost of just some of the infrastructure, like the phones, for instance, because we just upgraded the phones so that for Care Direct. So yeah, that's been awesome.
Fantastic. And Barry, as someone leading innovation in aged care, what trends or technologies do you think will have the biggest impact on the sector in the coming years?
Well, I think I remember having a chat with Charles would have been probably 4 years ago. We were talking about beacons and putting that into aged care, and thinking, that'd be fantastic. And here we are today. Like we've got the AN-ACC tags, which are in the rooms, which has been that's just an amazing piece of technology where you can put a tag and you can program that tag to the specific resident. So if that resident leaves the facility and a new resident comes in, it's actually that resident's profile will come up when the staff tap the NFC tag in that residence room, which is just brilliant. I'm really looking forward to the clinical care direct and the wellbeing care direct. So effectively, Star Trek buff, but like it's almost like the staff walking around with tricorders. They're handhelds walking around, not iPads, but phones that are it's not an old term, smartphones, but it means that staff are providing care on the go. They're not the desktops will be a thing of the past. That's how I see it. Yeah.
Yeah, and Barry, what advice? Oh, sorry, keep going.
I was just going to say, like the Care Direct technology can go anywhere. It's just the imagination that holds them back. I was talking to a home care provider. Do you know what I mean? And potentially, Care Direct could be used in a home care environment, not just in a residential aged care setting. There's so many applications that Care Direct can be applied to. It's just really a groundbreaking piece of technology, I feel.
And I guess finally, Barry, what advice would you give to aged care providers considering digital transformation but concerned about costs or disruption?
So I've implemented Accredia across Signature Care. So when we've got 3 homes which we've just finished the implementing, swapping out another platform, and then putting in Accredia, and that was very easy. The training is extremely easy. I've implemented iCare in the past. Accredia is far easier to implement. The training's really easy. So we probably we had a data entry team which helped bring the information across from one solution to another, and that took possibly 2 weeks for probably over 200 beds, and then the training itself is a week. And that's because most people would try to go, well, we'll do progress notes and then we'll do charting and then we'll do, but with Accredia, we did the whole lot in the week, and it's been seamless, and staff took to it really well. So it's been a total success in implementing the system.
All right, David, we are back on. Just when it comes to, I guess, what else that we need to do. Do you have any questions for me, David, following that time?
Definitely. I think we've talked a lot about the Accredia platform, but there's a multitude of other aspects when providers are looking at their advancement into the next phase of delivering care and digitizing as much as they can. So, I mean, what other surrounding technologies can residential care providers consider for a successful deployment, and how can someone like you, Connected Health, assist?
Yeah, absolutely. I mean, there's a few things to consider, especially at the core of that is your Wi-Fi. So making sure that you have an enterprise-grade Wi-Fi network that has been deployed for running roaming voice. The reason I say that is it gives you more options when it comes to the device that your care staff use to access Accredia's care application. At the end of the day, the aim is to have that on the spot, be able to enter data, and you need a robust device to do that can, that is ruggedized, but is also able to be used for multiple functions. So like with telephony and receiving nurse call alerts. So staff just carry one device instead of several. Peripheral to that is whether you would like to use Bluetooth to trigger access to that resident information and capture presence, or would you like to streamline the signing process so staff only sign on one and once to a handset, and then you can actually track your devices and see who's been using them, as well as securing health data. Addressing these considerations is where Connected Health can assist. We consult with residential care providers to understand what they currently have, their pain points, and what they want to achieve. We then work with them on an integrated solution with converged technology, with many use cases that ultimately enables providers to get the most out of their investments and deliver better, more efficient care. As the facilitator of the solution, we then connect providers with our certified and skilled partners to deliver these solutions Australia-wide.
Great. Yeah, I know that's super important when you're looking at an entire implementation. What are those other aspects? And having that network that Connected Health brings is amazing to vendors such as Accredia to rely on that support that we can provide to our providers.
Fantastic. And I mean, finally, I am conscious of time and obviously we have gone over, but if there's any questions, now is a good time to jump in.
There were a couple of questions that were already posted. So one was, will a recording be available? Yes, we'll send that to everyone at the end of this call. And a second was, what other challenges may you encounter during the adoption of Accredia? I've answered that question, so that will be made available in the response email as well.
Okay, great. Well, what an insightful discussion we've had. We've seen how Signature Care, now Lucent, with the help of Accredia, is truly redefining aged care delivery. Their journey highlights just how impactful technology can be in transforming operations, ensuring compliance, and most importantly, improving the lives of residents and their families. One standout example is how real-time tracking of care minutes is not just streamlining staff scheduling, but also boosting efficiency across the board. Features like automated care statements and transparent feedback channels are empowering residents and families by improving communication and making care delivery more inclusive and personalised. Accredia's ability to integrate seamlessly with other systems, combined with its mobile-friendly, customisable tools, is a game changer. It's cutting through the clutter of redundant workflows, allowing staff to focus more on meaningful resident interactions. And let's not overlook the strong security measures and compliance tools that help providers adapt swiftly to regulatory changes, offering peace of mind while maintaining the highest standards of care. Ultimately, today's discussion has underscored the transformative power of Accredia's operations in a box approach. By fostering adaptability, transparency, and innovation, solutions like these are not only modernising aged care, they're helping create a future where resident-centred care and operational sustainability go hand in hand. Thank you to our panellists and for all of you joining us today. We hope you leave inspired with ideas and insights to take back to your teams.